A public health official in Texas predicts that the measles outbreak could last a year. Once eliminated in the U.S., the virus could become endemic again. The expanding measles outbreak that has spread from West Texas into New Mexico and Oklahoma could take a year to contain, a public health leader in the area where the outbreak started warned on Tuesday. Catherine Wells, director of public health for the city of Lubbock, said the outbreak is still growing, with capacity to transmit both locally and further afield through spread to pockets of unvaccinated individuals. Even though the response teams have been emphasizing the significance of vaccination, Wells stated that vaccination uptake and quote, has definitely been a struggle, and quote, this is going to be a large outbreak, and we are still on the side where we are increasing the number of cases, both because we're still seeing spread and also because we have increased testing capacity, so more people are getting tested, Wells said during a press conference organized by the Big Cities Health Coalition, a forum for leaders of metropolitan health departments. I'm really thinking this is going to be a year long in order to get through this entire outbreak, she said. As of Tuesday, Texas has confirmed 279 cases, though that number is undoubtedly an underestimate. There are now cases reported in 11 counties in Texas, with the epicenter of the outbreak in rural West Texas, in a community of Mennonites who do not vaccinate their children. Only 2 of the confirmed cases in Texas have had the recommended 2 doses of measles-targeting vaccine. To date, Texas has recorded 1 death in this outbreak, in an unvaccinated school-aged child. New Mexico has recorded 38 cases and 1 death, in an unvaccinated adult. Oklahoma has reported 4 confirmed cases, all in unvaccinated individuals. That evidence of spread underscores the challenges public health faces in bringing the outbreak under control. I just think that it being so rural, now multi-state, it's just going to take a lot more boots on the ground, a lot more work, to get things under control. It's not an isolated population, Wells said, though efforts to increase vaccination rates among the most affected communities are not meeting with substantial success. Wells said in Lubbock about 300 more doses than normally would be administered have been given in the past couple of weeks. Mixed messaging about the best way to combat measles could be contributing to the difficulties in bringing the outbreak to a close, suggested Phil Huang, director of Dallas County Health and Human Services. All levels, Huang said, all of us, from the highest level down to the ground level, need to be reinforcing that message about the importance of vaccines and that vaccines are the way we prevent this and are going to address this. And need to address this. And we do have some concerns when some other messages might dilute that message. Simbo IJ, Chicago's Commissioner of Public Health, spoke of the struggles her department faced last year during a large measles outbreak that began in a migrant shelter in the city. Over the course of the outbreak, 30,000 doses of vaccine were administered, she noted. And quote, we didn't get rid of the measles because of vitamin A, it was the vaccination, IJ said.